Hello, everyone. I'm Dani, and welcome to our podcast. Today, Great.com talks with Colin Craig, the president of Second Street. If you haven't heard about it, Second Street is a Canadian organization that explores how government policies impact everyday Canadians. And if you're new here to this podcast, press subscribe on YouTube or in your podcast app. Hi, Colin. Welcome to our podcast.
Well, hi, Danielle. Thanks for having me.
Truly our pleasure. I'm actually super excited to talk to you today because, I feel that most of us has this sense of we don't really know how public policies and how politicians' decisions actually affect our everyday life and our citizens, in a country. So how exactly the Second Street acts and how you're helping to make this relation better?
So, yeah, you made a good point. Governments have tremendous power over our lives. And it's beyond just sort of taxation. You look at your paycheck and a chunk is gone because the government's taken it. But then there's all kinds of fees that we pay, sales taxes and so forth. But beyond sort of financial impacts to us through taxation and fees, governments also make all kinds of regulatory decisions. They control what businesses can and can't do, what individuals can do in terms of workers, policies and procedures and that are available to patients. So there's all kinds of different ways that governments have a role in our lives. And it's important for people to pay attention to what's going on and not just listen to politicians, because they always make these big claims about what their decisions and announcements and funding proposals and that are going to do. And then there's sort of, well, what actually happens? So what we try to do is we're a think tank. We research what governments are doing and how policies affect people, but we really try to tell stories to humanize the effects and ask everyday Canadians, how does that healthcare policy affect you? How does that natural resource policy affect you, or a taxation decision or whatever, so that we can really humanize what's happening. And the other important thing with stories is that people remember those stories over time. Whereas if I tell you a statistic today, chances are you're probably going to forget it a week from now. It's just the way the human brain works. But when people remember a good, compelling story, they'll remember that over time.
Yes, and I think that's the best edge anyone can have on it, because it's so true. I would probably never remember if you told me a number, but if you'd say a name and you show me a face and, I can actually make a picture in my head. So it makes all the difference. And how did it begin? How this idea came up?
So it started by my colleague and someone else that I know who had previously worked for another organization I worked for. And the two of them had gotten together and they decided that, what, for many years, there had been sort of this recommendation that we meaning think tank groups in Canada, needed to humanize things a bit more, make it a bit more understandable and relatable for people. And so what they decided was, okay, well, let's create a new organization that does nothing but focus on storytelling to really try to humanize these effects. And so they sat down, and it took a couple of years to develop a business plan and raise some initial funding. And we launched publicly in, I believe it was February of 2019. So it's been about 3 years now. So we're still new, getting our name out there and building a brand for ourselves. But we're pretty proud of what we've accomplished to date. And we're hopeful that we can continue to do even more work in the future. And I'll tell you something about our name. It's secondstreet.org. And because we're trying to focus in on this grassroots perspective, we decided on the name Second Street because it's actually the most popular street name in Canada. And it's the most popular street name in the United States too. I'm not sure about other countries, but we thought, well, that's kind of an interesting little fact that a lot of people probably don't know. But at the same time, it's a good tie-in between sort of this grassroots approach that we're trying to take, but also sort of this interesting little fact that we came across. So that's why we're called secondstreet.org.
Well, I love that fact. Well, it's not such a common name here in Brazil, but it's a good thing to know. It actually makes a difference because that helps us to understand better the country, helps us to see how you guys are organized. And in all the areas that public policies cover, you mentioned to me before that you have two main interest areas. Mm-hmm. Tell us a bit more about that.
Yeah, so one of the main areas that we've been working on is healthcare. And the sad reality is that a lot of patients have been suffering in Canada for many, many years. We have very long waiting lists in Canada. And it's not that our government doesn't spend enough money. Spending has increased and increased and increased well above inflation for decades now. Governments just keep throwing money at the system and hoping that it's going to improve results. But we really have seen waiting lists continue to grow. Part of that is because we have an aging population, and part of that is that structurally our system is just not conducive to being a high performance model. So the end result is you end up with patients suffering. It's not uncommon to hear of Canadian patients waiting a year, 2 years for surgery or to see a specialist, and there's some pretty sad stories out there involving patients. So in one case, the first story that we actually covered was a senior citizen in British Columbia, which is the westernmost province in Canada. And she was living in Vancouver. And what happened with her was that she was told she'd have to wait 1 to 2 years for hip surgery. And it's a very long amount of time. And it's worse when you're living with chronic pain. And she was living with chronic pain. And so the government's answer was, we're sorry, you're going to have to wait. And here's some painkillers. And so naturally, she was concerned about the impact of painkillers on her body. Painkillers aren't meant for people to take for a year or two. So there was that concern. She was a very active senior citizen before her hip pain began. And it meant that once she ran into these hip problems, she basically had to sit on the sidelines of life. She couldn't go out with her friends like she used to. She couldn't go walking and traveling like she used to. She liked to take Spanish classes. She couldn't do that anymore. Her grandkids, she couldn't even cuddle her grandkids or babysit them because they were too active. She couldn't keep up with them. And when they'd come and sit beside her and crawl all over her, it would cause her immense hip pain. So this poor lady, her name is Jenny McKenzie, she, it got to the point where she couldn't even put on her socks because it was tremendous, tremendous pain. So she had to get the special device that she would use to put on her socks. And, the end result of this is we have to ask, well, why is it? Why are so many Canadian patients suffering like this? And one of the problems is that the government makes it very difficult for Canadian patients to access private healthcare. We have a public healthcare system, and governments make it hard to access the private options. So then everyone has to depend on the public system. And it struggles with efficiency. It struggles because everyone is depending on it. And there's other problems with it. So, what we've been showing is that in other countries that perform better, they have the two options. You have that public healthcare system so that everyone is covered, whether you're rich or poor. But at the same time, patients have choice. They can go outside of the public system. And when some patients decide to do that and pay privately, well, you shorten wait times in the public system because there's not as many people depending on that procedure. So that was one of the stories we told early on. A more recent story, which is actually very tragic, involves a former nurse who lives just east of Toronto. Her name is Judy Anderson. And what happened with her was her daughter was having heart problems in, I believe it was January of 2021. And she went to the doctor, and to make a long story short, the doctor said, well, you've got atrial fibrillation. It's a treatable condition, but unfortunately we can't provide you with surgery for until about a month. So you're gonna have to wait a month until you can get it. So she was concerned. She went to another doctor, and that doctor said, well, there's an alternative procedure, but you're gonna have to wait a year before we can get it. So she was very upset by this. She didn't really have any other options but to depend on the government because there were no private options for these procedures. And traveling during the middle of a pandemic just wasn't a good option for her. So she waited and waited and waited until the point where sadly her health deteriorated, and she had to call her family over and say her goodbyes. And sadly, she checked into the hospital a few days or the next day and passed away a few days later, leaving behind 4 kids. So it's a tragic example of Canada's healthcare system. And we've heard that story far too many times where patients are suffering and sadly many are actually dying while waiting for surgery. surgery that can save their lives in some cases, and certainly in other cases it means that their final year or 2 years or 3 years or whatever it is, they're living with chronic pain while they're waiting for their hip to get done, or they're having cloudy vision because they're waiting for their cataracts to get done or whatever. So those are a couple of the stories that that we've been telling as an organization, and we feel that they kind of help humanize and help the public understand just what some patients are going through. And we always talk about solutions that we can improve the public healthcare system so it can deliver better results for patients.
Well, I am here thinking, and I'm actually kind of shocked by the stories, I admit to you. And I think it's so interesting that you bring this perspective to us because, well, as a non-Canadian person, I think that, well, these are my references, we usually think about health issues in comparison with the United States, and where we have the opposite, right? The very opposite of it. To have a whole privatized sector. And we usually think, oh, yay, Canada is great. They have a public health system and that works and everybody is happy and healthy and fine. And then we have this actually deeper and humanized look to see the real issues on it. And we're not saying here that it shouldn't exist, it should be all privatized. Actually, as we're seeking a balance, as you said, right? And I think this is very, very crucial to understand right now on this health crisis we are all living, right, with COVID and all of that.
Yeah, it's really tragic because I think Canadians have become numb to the situation that we're in. And for our biggest problem when it comes to healthcare is that we're located beside the United States. So whenever people talk about health reform, the discussion so often comes down to, well, it's our system or the United States. And it drives people in positions like mine, drives us mad because there's nearly 200 countries on this planet. And there are lots of other systems that we can learn from. Canadians like the idea that there's a public system that covers everyone. And there's lots of other countries that do that and they have better results. And what they do is they have the two options. You have the private if you want to use it, or you can use the public system. And they perform better than Canada. So it's very frustrating when we keep hearing, well, we don't want the American system, so we better keep ours. This is what we keep hearing from different people. And for a long time, it's been extremely frustrating because it's like, well, what about Europe? Why don't we look at what maybe Sweden is doing, or Australia, or some other country around the world where they have the two options? But yeah, like I said, it's sad. I think it's unfortunate that some Canadians have kind of just gotten used to this idea that we're going to have to wait, or they might have to wait a year before they get their knee done or whatever. And it's one reason why Canadians often travel abroad for healthcare. Over 200,000 patients a year are getting onto airplanes. They're flying to China, Lithuania, parts of the United States, Mexico, all over the world where they can find the healthcare that they need. And one of the points that we've made is that it's, you're harming patients by doing this because you're limiting their access to healthcare when they can't pay for these procedures in Canada. A second problem is the economic angle. When people take money out of our economy needlessly and spend it somewhere else, we're helping to create jobs in another country. So we've made the point that we could actually keep those jobs here in Canada, or create them, if patients could spend more of their own dollars on their health in Canada. But there's also an environmental perspective. When a patient feels that they can't get the care that they need in Canada, and they hop on an airplane and they fly to, as I mentioned, maybe it's China or Mexico or wherever, well, there's a lot of air pollution involved in that. So you could address all of these problems by allowing private clinics in Canada to do the same services as the public system. And ultimately it would help patients, help the environment, help the economy. There's a lot of good benefits behind health reform in that area.
Yes, absolutely. And how do you select the stories you're going to tell? And is there any special topic you'd like to talk more about now, or how does that happen?
So it usually, the stories, we try to find someone whose story connects with the data and the research. So if we're talking about a waiting list example, we'll talk to a patient that has an experience on a waiting list. I mentioned we did this research into patients leaving the country for healthcare. So we ended up finding some patients that have traveled abroad. So in one case, I was on a radio show here in Calgary and talking about Canadians traveling abroad for healthcare. And I said, we'd love to hear stories from Canadians if they have experience in this area. And then after I was done the interview, I got a call from a gentleman who lives about an hour north of Calgary here. And he said, yeah, him and his wife, they've gone down to Mexico a couple times and they've recommended it to, I think, his brother-in-law and someone else. And so we get stories from different ways. Sometimes people will see a column that we've had in the paper and they'll send us a note or they'll make comments on our social media pages. But we think it's important to get these stories and experiences out there so that people can understand what the real consequences are from government policies. And I want to be clear, I'm not saying that Canada's healthcare system is a complete failure or anything like that. There are people that have had positive experiences with the system. And there's a lot of good people that work in the healthcare system in Canada. They want to help patients. They're doing their best. The problem is the structure of the system. Overall, it produces results that are not as high as what other countries are doing. So that's why we're saying, well, wait a second, let's figure out how we can improve so that patients ultimately end up with better healthcare.
Yeah, and is there any other way that people can help out your efforts besides, saying, hey, I have a story, hey, I'm a mention here? How can people help?
Well, the easiest thing they can do is to watch our videos and read our columns and then share it. And with social media, that's one of the most powerful aspects of those tools, whether it's Facebook, Twitter, Instagram, YouTube, is that you can take that content and share it with your friends so that ultimately we can inform more and more people about what's happening. And we have seen some positive poll results. We've hired public opinion companies to do some research to ask Canadians about different healthcare reform options. And there's been, I would say, a positive shift in terms of public opinion towards supporting health reform. So that's positive. And one way that public opinion shifts is by more and more people understanding issues at a deeper level than what they may have seen before. So people can certainly share our content. If they like what we do, they can make a donation. Or maybe if they have friends who have the funds to make a donation, if they're low on money right now, they could get a friend. Hey, if you want to donate to an organization, you could consider this organization, secondstreet.org.
Oh, that's great. I hope lots of people actually donate because it's important to keep things running, right?
Thank you. Yeah.
Yeah. I think we have room for one more question. And something else we mentioned before was some issues involving environment and, other policies. What stories have you covered on that? I think it's nice to hear about it as well.
So yeah, I'll tell you something that I think is really cool. It's a video that we produced on climate change, because around the world, you're finding people are concerned about the issue. They want to figure out how we can reduce emissions. And what we've noticed is that there's a lot of really cool things that entrepreneurs are doing to reduce emissions by capturing CO2. Instead of it going up into the atmosphere, they capture it and they make cool things with it. And so there's a company in New York that is taking CO2 and they're making vodka with it. There's a company here in Calgary that's taking CO2 and they're basically creating a material that they put into cement and it helps make concrete stronger. So instead of it going into the atmosphere, it's being used to help build something. There are companies that are making crayons out of carbon dioxide, soaps, hand sanitizers. There's all kinds of really cool stuff that entrepreneurs are doing. And if you really think about it, Danielle, CO2, it's made up of elements. And these are materials that are building blocks that you can make things with. So in the case of vodka, the main ingredient is ethanol. And it's made of three elements: carbon, hydrogen, and oxygen. And you can find those three elements in water, H2O, and carbon dioxide, CO2. So what they've been able to do is take these two ingredients, water and carbon dioxide, and rejig them so that you can make the main ingredient for vodka. And that's much better use, I think, for CO2 than letting it go up into the atmosphere. And, you know, you're not going to save the planet by taking CO2 and making vodka, as much as some people might like to have a vodka here or there. But, you know, it's an example of something cool that can be done. And I think that that's where we need to be spending a lot more time focusing on these positive stories, because so much of the discussion about climate change, it's doom and gloom, it's negative, it's fear mongering, and entrepreneurs are doing some very inspirational stuff. And I think we need to be talking about that more, discussing how governments can help entrepreneurs to you know, figure out ways to capture CO2 in that, rather than, you know, like I say, the doom and gloom. I don't think that's very positive.
Yeah, that's so very true. And thank you so very much for sharing that story. I loved it. I love the fact that we're ending this talk today with that story because it's truly, well, I'm not lying that I like the vodka bit. I'm actually going to go search for that information. But
it's good. It's good vodka. I've tried it and it's
yeah.
very, very smooth. It's called, the company's called Air Company. So if you Google Air Company, you can find their vodka. I think they're still relatively new, and so they're, you know, building up their supply chains and trying to export it to different countries and that. But like I say, they're based in New York, so if you can't get it in your country, you might have to fly to New York to go try it.
Well, I'm definitely going to search for that and then search for flight tickets.
That sounds good.
Well, thank you so much for joining us today, Colin. This has been a great talk.
Thanks for having me.
Truly, our pleasure. And for everyone else listening, also, thank you so very much. And if you enjoyed this episode, press subscribe on YouTube or in your podcast app, because that shows the algorithms that this is an important conversation and more people can learn about the importance of the Second Street organization. See you at the next episode.